A 32-year-old female patient presented in OPD with low-grade continuous fever for last 6 days. Low-grade continuous fever. He has pain in abdomen. She has pain in abdomen, vomiting. Fever, pain, vomiting. On examination, her blood pressure is 110 by 60, pulse is 68, and temperature is 101.5 Fahrenheit. Abdomen is soft but tender with the tip of spleen is palpable. Okay, tip of spleen is palpable and fever with abdominal pain. What we can suspect, whether typhoid for fever, because pain, tender spleen and enlarged spleen and fever, or we can suspect malaria. But in malaria there is no we can say abdominal pain. Most common in malaria occurs pain in joints as well. So we can also not suspect the patient having dengue, because there are no clinical features of dengue. So spleen enlarged and abdominal pain with vomiting and spleen palpable, tender spleen, we can suspect the patient have perhaps patient has typhoid fever. So most likely diagnosis is typhoid. What is the single based investigation for typhoid is blood culture. And the drug of choice for this disorder, what are drugs used for NARST? Okay, quit this NARST. So the diagnosis of the patient, yes, typhoid fever. And the best investigation is bone marrow culture. Okay, bone marrow culture can be performed. And drug of choice is ciprofloxacin 750 milligram BD. And uh, okay, leave this. So this is a patient of typhoid. And typhoid, what happens, there happens fever, there is vomiting with tender abdomen, and spleen is palpable, mean splenomegaly. And another thing, relative bradycardia is also present in the patient of typhoid. There are rose spots on the body, and enteric fever occurs in the typhoid. Treatment is ciprofloxacin 750 milligram